Recording is on, Richa? Richa?
Yes, it is.
All right. Just wait for 1-2 minutes and we'll continue, and then we'll have a recorded session for reference. So there will be no uh,
All right.
sort of, because we have our own library for reference, and that is the aim, that
Sounds
regardless
good.
of the current attendance, we are able to guide all the people.
Sure. That sounds good.
So, Richa, we will be very punctual upon times. First of all, I would like to introduce Richa Tiwari. Richa, would you, on behalf of Digital Health Association Pakistan, we are extremely grateful and thankful to you for providing us this opportunity to learn from the foundation models of Google, which are playing a vital role in improving the health outcomes of this world. So, would you like to introduce yourself? And over to you, madam.
Thank you, Dr. Malik. It's a pleasure to be here, and I really do appreciate the opportunity for me to present on Google's AI models and foundation models and tooling on behalf of the team. So I look forward to presenting and talking through the various different health AI-based innovations that our team is focused on. Just to introduce myself, my name is Richa, and I'm a big program manager leading a lot of our health AI innovations within Google. Just to give everybody a little bit of an understanding around how we operate. So obviously everyone is familiar with Google. You're familiar with Google Search, you're familiar with YouTube, Google Ads. Uh, but our team actually falls specifically under Google Research. And what Google Research essentially does is we're the research engine of the company, where we do a lot of deep research and R&D focused on bringing some of the most advanced innovations to market, whether it gets deployed into Google's first-party services or externalized with partners in the external community. And my role, actually, my background is in healthcare. I have a PhD in oncology. I did cancer research, and I worked in pharma for several years, bringing life-saving cancer medications to market and helping run clinical trials. And about 6 years ago, I joined Google Research. And my role was actually not unlike what I did before when I was working in pharma. Previously, I used to work with doctors, clinicians, healthcare professionals to bring cutting-edge medications to market. But now in this capacity at Google, I bring cutting-edge AI technology to market with a similar set of stakeholders. We work with government, we work with hospital systems, we work with startups. And the idea here is really to bring impact. We are focused on making sure that whatever we are able to bring out into the world, we're able to enable people and bring actual patient impact and improvement in healthcare systems. So that's just a little bit about my background. And the focus for the discussion today is to talk about some of the recent advancements and recent updates that we have made in terms of AI innovations and foundational models that we have made available. So without further ado, I'll move on to the next slide. Just a little bit of a word about the format for the meeting today. I'll provide an overview general overview about the different types of models and digital health solutions that we have available. And feel free to raise your hand and ask me any questions. If there are any specific technical related questions, I'd appreciate it if you save those for the end of the call. And as accordingly, I will triage and I will essentially transfer these questions to our technical team and our engineering team to be able to address offline. So my focus today is really to just give you an overview and to give you examples of how it's being used in real-world solutions, examples of how these solutions are being used in real-world settings. But any specific technical questions, I'd love to be able to discuss that async over email or collect these questions to be able to answer at a separate occasion. But otherwise, feel free to stop me if you have any questions and you need to make any clarifications.
Sure. Thank you very much. So as you reiterated, if there are any technical questions, they will be addressed at the end of this presentation, and for follow-up can be liaised with me via email through you. All right. Thank you very much. Please proceed. Over to you.
Yes. So as I mentioned before, I represent the team at Google that's under Google Research, and we're very much focused on health AI. And our mission essentially is to catalyze the adoption of human-centered AI in healthcare. And how do we live up to that mission? So there's two ways that we believe in doing so. One is we show the world how do we build safe and effective AI solutions. And we show this through publications and through doing prospective studies and actual real world testing and feasibility studies of our AI. And in fact, Google is one of the few technology companies that has as many publications as any kind of any hospital or any academic institution. We are the most prolific in terms of our publication of our research that we do. We also live up to our mission by enabling others. How do we enable others? We do so by actually making it easy for others to be able to leverage and build AI for their specific use cases. So we want to make sure that not only are we making these models, but we want to make it accessible. So we provide many of our pre-trained models available on open source platforms, and we provide tools to optimize them for people to use. And basically, to advance on our mission, we look at it in a very holistic way, alongside the external partner community that we work with. And when I say partner, I mean people from the external community that could be startups, developers, clinicians, healthcare professionals, NGOs. We work with a whole range of them. And so underpinning all of this work, that this kind of little ladder that I've presented here on screen, underpinning this work is basically ensuring that our work has interoperability and data processing infrastructure. So that infrastructure at the crux of it all is a foundational layer that's required. And I'll speak to that in a few minutes about how we address that. And then once you have that strong foundation, that's when the idea of being able to create AI diagnostics comes into play. So then you are able to make AI diagnostic solutions. You can have mobile health sensors or leverage various different technology, AI technology, once you have that strong foundation of interoperability infrastructure. And then on top of that, we want to be able to have, provide recipes and toolkits and documentation for people to be able to actually use these models in ways that are very specific and customized to them. And then finally, the final piece is partners are able to build applications based on their needs in their respective regions and in their respective settings and what have you. And so Open Health Stack is our product that is focused on enabling interoperability across healthcare systems. And MedGemma, which is what I'll talk about after that, is our product that's focused on, is an example of our open weight model that we recently just released out in the community. And so I'll spend a few minutes talking about Open Health Stack, and then I'll move on to MedGemma. So just a little bit about Open Health Stack. Given that you are a digital health association, I'm sure you can appreciate the fact that digital technologies are quickly becoming the backbone for delivery of healthcare around the world. So in low resource or emergency settings that are often account for some of the hardest to reach communities, digital technologies are an essential tool for delivering care, and not only delivering care, but delivering it at scale. And it also plays a key role in to address health equity gaps. So one example I can give you, which I think is in recent memory, a lot of people will be familiar with, is during COVID-19, during the pandemic, mobile vaccination certificates and electronic immunization registries really came into the forefront, and they really reinforce the potential of digital tools. And we've also seen that digital health implementations across diverse geographies and use cases using digital health technology, right? So for example, from non-communicable disease settings, screenings, to antenatal care, humanitarian responses, and outbreak surveillance, digital health tools have been really instrumental in all of these settings. And so this next video that I'll show you will give you a flavor of what Open Health Stack enables in the digital health setting. So I'll just play a video real quick. One moment.
Every day, I wake up very early in the morning. I have a lot of work to do. I'm a CHV, Community Health Volunteer.
We call it a community health volunteer. We mostly target pregnant women, visiting them, check up on the mothers.
Jasmine. If we didn't have the CHV, we will lose a lot of babies because there's nobody to come and educate the mothers.
Oh, Stella. When Stella came, she told me you have to go to clinic as early as when you get pregnant so that you can be monitored. Wow, good.
So much of my job is recording information. The records are very important for the mother's health. I have books, even they can't fit in my bag, you see. I really like the app because I don't need to carry all these things. I go to the app, I see everything about the mother. The app is very, very good.
Good afternoon. Good afternoon. We're here with my team to introduce Mama's Hub to you. Mama's Hub is a solution designed to be able to capture timely information about an expectant mother in the entire continuum of care.
This is how it looks. You'll see the client and you're going to be able to see all her details.
Timely, accurate, complete information. Enough for the health facility to save lives.
I'm probably too emotional about the work I do, so I think a lot about how can I use technology to improve people's lives.
When we were starting to work on the development of Mama's Hub, we were constrained for time and resources. Intellisoft told us about Open Health Stack and its capacity to help us deliver quickly. It made us feel empowered.
I look at Open Health Stack as having a Ferrari in your hands. Open Health Stack is a suite of open source components for building next generation healthcare apps. These are standards based, they're offline capable, secure, and adaptable to different healthcare settings. With Open Health Stack, it means that you've got all these building blocks. I'll put them together and I'll very quickly build a solution. Without Open Health Stack, Mama's Hub first prototype would have taken us about 9 months. With Open Health Stack, we reduced the 9 months development lead time to 3 months. Yeah, literally. With the Open Health Stack, Google deliberately designed from scratch for the environment where resources are very scarce. This tool that I'm putting in a woman's hands needs to give her the same exact privileges as somebody who's living in New York.
Every mother should understand how your health is doing. I think it is important for the mother and for the unborn baby. When a mother is expectant, she needs that care. She needs that love. When you're happy, even the fetus is happy. When you're strong, even it is strong. You find that it kicks. I just thank God that Stella and the rest of the community, they just decided to come and assist these mothers. It is awesome.
So that was just a quick video to give you a sense of what Open Health Stack is able to do and to bring to life and really help you visualize what the value of Open Health Stack can be. And just to take a step back, first of all, I think we all recognize that there's a huge need to find ways to improve access to quality care around the world. And these statistics speak for themselves. 52% of people don't have access to essential health services. And that in itself leads to 9 million preventable deaths annually due to lack of access and quality care. And so, this is a real situation that, is a challenge. And so there's been a lot of interest in figuring out how to use mobile technology and digital health technology to address this problem. And we believe that mobile and AI can really extend access to quality healthcare for all. But to date, there's been challenges with realizing the whole potential of digital and AI. Firstly, there's a lack of standards. And what that means is that, there's no common exchange of common language or common exchange of data that enables data to be interoperable. Data is like in silos, right? You've probably heard about how healthcare systems, one hospital has its own system, a different clinic has its own system, data doesn't travel, doesn't flow. And so essentially the idea of data being in silos is a real challenge. And we've also seen that, it's other challenges also exist, like poor design and usability has made it really hard for people to be able to adopt many of these digital solutions, and evidence-based guidelines often get lost in translation, also contributing to poor quality care. So there's a few challenges at play here. And so, Google is really well placed to think about problems at a global scale. And so we worked with global health ecosystem partners to construct the idea of full stack. And what we mean by full stack is the following. S stands for standards, T stands for technologies, open technologies, A stands for open architecture, and C stands for content, open content. And I've given in this slide examples of what each of these components, examples of each of these components. So Open Health Stack represents open technologies, which are part of the larger piece of the puzzle where all of these components come together. And the convergence of these factors can really help meaningfully address health equity gaps and improve health outcomes at scale. That's really our mission. And we published a paper on this as well. And so essentially the idea here is that with the right strategy, one that involves country leadership, good health data governance, evidence-based decision-making, operability, digital transformation across government systems and hospital healthcare systems can really be realized. Just a quick word about interoperability. When we talk about open standards, we're usually talking about FHIR, F-H-I-R. I'm not sure if the audience here has been familiar with FHIR, but HL7 FHIR is basically the health standards setting body, and FHIR stands for Fast Healthcare Interoperability Resources. So FHIR has been around for a long time, and it's only been in the last few years that it's achieved a certain level of maturity, and it's now widely seen as enabling interoperability and driving a lot of standards-based innovation. So FHIR essentially is a common schema for health data and information exchange. And so the idea here for us with Open Health Stack here on the left hand of this illustration, you can see that developers today have to deal with and solve for a lot of hidden complexity when it comes to making solutions. And this can really hold the field back from its potential and scale. They have to essentially think about all the different components, the technical burdens, financial burdens that software developers face. And the idea here is that with Open Health Stack, we want to make it easier. And so this kind of problem is really well suited Google as a technology company with a global reach. We can really provide enabling infrastructure and reduce the complexity that developers face. And that makes it easier to adopt healthcare standards like FHIR, and really make it easier for local innovators to build solutions for their specific local problems. And so what is Open Health Stack is that it's essentially a suite of open source components, modular in format, so they can be used all together or individually. And the idea here is that they're aimed to help accelerate the development of next generation digital health solutions. And these components are aimed at helping save time, build better healthcare apps, and they're focused on open standards, security, and advanced analytics. So there's these different pillars that you see here on the slide. The three different columns here are the three different components representing Open Health Stack. The first component, which is called the Android Fire Software Development Kit, it makes it easier to build Fire-based apps that can be operated fully offline, which is extremely useful in lower resource settings where you might require offline capabilities. Similarly, we have Fire Analytics, which is the middle column. That makes it possible to deploy and gain population-based insights for your specific district or your healthcare system, to be able to see what are the trends, what are the treatments that are being received, what is the level of immunization in a certain region, really pulling out like large, rich insights using structured data with Fire. And lastly, the third column represents Info Gateway. Oh, sorry, Info Gateway is the middle column. The third column is Fire Analytics. And Info Gateway is more about access controls and settings, depending on whether you are a community health worker and what you can access in terms of data, whether you're a doctor who can have more of a larger view of the settings, or an administrator who has basically able to have control settings across the digital health application. So that's essentially, those are the three different components that comprise Open Health Stack. So just to give you a sense of how it's being used today, the video obviously gave you an example of what that was like. We have actually worked very closely with the people who were in that video to deploy Open Health Stack in Kenya, and it's very actively being used there as part of a health immunization platform in Kenya. But we also have a global and diverse ecosystem of tech innovators. We also have implementation partners who work closely to implement these digital health solutions, often on behalf of governments. We also have global institutions, which are funders and donors that are able to enable this work. So this is a map that is a reflection of our current, in progress, and planned projects that are powered by Open Health Stack. And you can see that there's, a lot of our the implementations are happening in Africa, in Asia, Southeast Asia, and also some in North America as well. So it's really across the board here. And an example, I'll give you the most recent example of Open Health Stack enabled digital health solution. This is a TB screening that was implemented within the state of Rajasthan in India. The state of Rajasthan has a population of 50 million. And the state government had the mandate of deploying a TB screening program in compliance with the government's mandate of basically, following their government-based digital health infrastructure and being compliant with the government-led initiatives. And so they had to roll out this program in a short amount of time across the state and be able to integrate all the data within the national TB portal. And that was a big, tall order. And what would have taken them maybe a year or perhaps even almost 2 years to build was made much faster because they worked with Open Health Stack to basically use that tech stack to be able to build that solution. And so the State Department was able to engage with this specific technical partner to launch this application that basically is able to screen for people who are vulnerable for TB. And they were able to build this in a very short amount of time, under 6 months. And this was secure, offline capable, and a configurable platform. So it's really great to be able to see how something was able to be built and deployed within a matter of just a few months with a statewide deployment. And they're actually now looking at this on a larger scale and expanding this to other states within the country as well. So that's just an example of how Open Health Stack provides that enabling infrastructure to be able to build and power digital health applications at state level, national level, or even district level, depending on the needs. So if anyone's interested to learn more about this, our website link is shared here. These slides will also be shared with you, so you're able to reference them later. And if you have any specific questions, our email is shared here below as well. So I'll pause here just to see if there's any questions, anyone has any comments. And then following that, I'll move into our discussion on our foundational models.
Hello, I would like to ask, thank you for the presentation. I would like to ask, is this model good only for particular applications, or does it work as a full health information system comparable to Oracle Health or to Epic?
No, so that's the, I should have clarified that earlier. It's not your end-to-end solution. It's essentially your building block to build your end-to-end solution. So for example, if you're talking about Epic, let's say, you want to make sure that Epic is now being able to have the data flow with other platforms or other systems or other solutions that might be involved. So Open Health Stack is able to, first of all, it's Fire-based, right? It's Fire native. So it's ensuring that the data interoperability exists between two different solutions or two different platforms, and is able to help you build your healthcare application using the stack of code that Open Health Stack provides. It's essentially your software development kit that enables you to build your end-to-end solution. It's not the solution itself.
Understood. Thank you. And for the use of these places, you showed it in Asia and Africa and some in North America. We would like to seek solutions for Latin America, and we would like to know if with Google you have a licensing model, or it's like an open source sort of model where you can build on it.
Yeah, it's open source. And the name Open Health Stack should give that away. It's open source. And actually we are, we've also often partnered with regional digital health networks to be able to build awareness and do capability building or capacity building workshops with developers and implementers to build sort of a, I guess, knowledge and understanding on how do you actually leverage Open Health Stack. And so AHIN is an example of one that's based in APAC. There's one in LATAM as well that we've been looking at. Essentially, we want to be able to build capacity amongst the community for people to be able to use them very easily. Now, on our website, we have documentation, resources, tutorials, all the breadth of information that one might need, a developer might need to be able to sort of understand and get up to speed. We also have a very active weekly calls, developer forums online for being able to provide support and answers to any questions on the go. But the idea here is that we really want to, it's really a community-driven initiative. And we are at the forefront making sure that this is actually being leveraged and well supported for those who want to use this.
That's great. Thank you.
All right. Zohaib, please go ahead. Yeah. Zohaib, you raised a hand. Please go ahead. Do you have a question?
Yeah, I do. Thank you, Dr. Asfar. Thank you, Richard, for the presentation. Could you please share the link to the resources you just mentioning?
So if you go to ohs.dev, which is listed at the bottom of the slide, it'll take you directly to our website, and there you will see on the top menu, documentation, resources, tutorials are all there. So you shouldn't have any problem finding it. But feel free to reach out if you have any specific questions. Happy to answer them. And the email is provided at the bottom of the slide as well.
Thank you.
All right.
Thanks.
Qaboos Khan, please go ahead for your question.
Hello, guys. Thank you for the presentation. So the question I had was, does this forum provide sources for existing applications which are not built via the FHIR compliance? Do you provide sort of APIs which would turn them into FHIR compliant, or some sort of integrations like that? Or do you have to just build it again?
No, so the thing with Open Health Stack is that you can build FHIR native applications, or you can even use legacy applications. So like it works in legacy systems as well that are not FHIR native. And so you don't necessarily need to be building on FHIR native platforms. So that's we want to be able to enable people who are using systems that don't necessarily use FHIR as well. And there's ways to do that. Happy to delve into that in a separate forum if you have more follow-up questions.
Jawad Rizvi, your turn, please. Go ahead.
Hello, everyone. Thank you for the presentation. I just wanted to know that what's your area of focus? Like, do you people only produce your solution, or you can say technology for clinical side only, or you have solution for the transactional side of the healthcare, which includes like claims and other processes to like billing and everything.
Yeah.
Like in US market.
Right. No, that's a great question. Open Health Stack is more focused towards providing that enabling infrastructure and interoperability for building healthcare applications. Now, what I'll talk about next, in terms of foundational models, there's an area to think about claims and processing and transactions there. So why don't we jump to that discussion, and maybe we can talk about that again and revisit this question at that point in time. But Open Health Stack is not specific. It's more around building healthcare applications. Let's say you want to build a maternal healthcare app, or you want to build a TB case, TB tracking application, or you want to be able to track your immunizations in across a certain district. It's essentially enabling you to build those kinds of applications that are geared towards population health, and are able to work in lower resource environments because it's offline capable, because it's secure, and because it's also based on, the way we've built our software development kit is that the libraries that we have, they're also in compliance with the World Health Association's like SMART guidelines. So they're based on evidence-based care. So it's a different kind of different area of focus. And your question about transactions, we can revisit that later in the call.
Okay, Jawad, quick question. Please proceed.
I just wanted to add to my question that your solution is white label solution, like we'll be using it on the back of our solution, like on the background, or will it be a front end kind of thing?
They're both. So the Android Fire SDK, the software development kit, is more of the building of the like the front end, and then we also have the back end server stuff, which is where Fire Analytics and Info Gateway comes in.
All right. Thank you.
Yeah.
Any other questions from any other participant? Okay, Richa, please proceed for the next part. So far, so good. Very exciting. Thank you.
So next, I'm going to talk about our family of open models. So again, open source, open weight models, which are available publicly. We refer to them as Health AI Developer Foundations because there's a family of various different models. But under that family of the shelf of high def, we have specific models like MedGemma, which is what I'll talk about and focus a little bit more on for the purposes of our call today. So what is high def? As I mentioned just now, it's a collection of open weight models and companion resources. And the intention here is really to help developers, researchers, and the healthcare industry at large tackle some of the challenges when it comes to, what are the pain points for clinicians? What are the pain points in building applications that can help summarize and reason and evaluate health data? We're really trying to tackle some of these key challenges, and the underpinning all of that is the goal of making it easy for anyone to be able to use this and adopt this. And that's why we've made them open weight and open source. So I'll talk a little bit more about what each of these models are. This catalog of models, there's two, I guess you could say two different forms of it, two varieties of it. There's under one is medical embeddings. So we have our foundation models that are focused on pathology, one that's focused on CXR, meaning chest X-ray. We have one that's on CT foundation. We have one foundation model for dermatology. We also have one that's called HEAR, which is an acoustics model based on cough sounds, and that can be used for lung-based diagnoses and lung-based conditions. We also have MedSiglip, which is our essentially another, it's a variant of Siglip, and it's trained to encode medical images and text into like an embedding space. And developers can use MedSiglip to accelerate, their healthcare application building as well. So that's one, I guess you could say, variety of models that we have. And then the new one, the other one is are the generative AI models that we have. And one is called Treatment Gemma or TX Gemma. This one is very much specifically focused on using this model to help with drug discovery and therapeutics, being able to look at specific data and reason over what kind of drugs, combinations, and molecular combinations will be beneficial in evaluating certain drug discovery approaches. So this is very specific for, I would say, bench work, life sciences audience and users. The other one is called MedGemma, and that's going to be the focus of my discussion today. MedGemma is more focused around the clinical and medical community of users, and it's actually focused on medical image and text comprehension. So while a lot of the models that are on the left-hand side of this slide are focused on specific tasks, and they're focused on input being input being the image and output being text. What's different about MedGemma is that it is multimodal, meaning it can take text and it can take image as input, and then the output, it will provide text. So I'll just delve a little bit more into that. So this slide here gives you our relevant links and information about MedGemma. So our website, which is shared here, is a source of truth in terms of providing all the details around MedGemma. And what that means is that includes the model cards. Think of model cards as your instructions for use for this AI model. It has information about how the model was developed, what were the data sets that we used for training and evaluation, what were the performance results, what are the known limitations, what are the terms of use, things like that. We also have hosted MedGemma on other platforms. It's available on Hugging Face, and it's also available on GitHub. So it's all available there for people to use. It's also available on the Google Cloud platform if you're a Google Cloud user. So let's talk a little bit more about MedGemma. So MedGemma is actually Google's most capable open model, and it's specific for medical text and image comprehension, and it was built on Gemma 3. So many of you may have heard of Gemini. Gemini is our paid model. That's our generative model. It's integrated into many of Google's surfaces like Google Search, and it powers a lot of the work that we do at the back end. Gemma is our open source version of it, and MedGemma is the medically tuned version of Gemma 3. And MedGemma's small size compared to Gemini makes it really efficient for fine-tuning for your specific needs. And so we have two varieties of MedGemma. So there is the 4B model, which is a slightly smaller model. And then we have the 27B model, which is slightly bigger. And I would say the pros of the benefit or the value proposition of a model like 4B is that it's very accessible. It's easy to adapt to your specific use case or application. Enables immediate deployment and customization. Now, if you have a lot more complex medical reasoning tasks and high stakes, medical diagnoses involved, like let's say, oncology-based or cancer-based diagnosis stuff, then you'd probably want to consider using something like the larger 27B model. Both are multimodal. Now, both the MedGemma models I mentioned have been thoroughly trained on 24 different medical data sets. So they have been trained on radiology data sets, which are outlined here, dermatology, ophthalmology, histopathology, and general Q&A data sets, which are, its performance is like benchmarked against all of this. So it's been trained across all of these different data sets, making it really quite comprehensive in terms of these variety of use cases you could explore across the domains of radiology, dermatology, eyes, ophthalmology, as well as dermatology. And what's really cool to see and really amazing to see is that MedGemma's performance is actually quite on par with many of the closed models that are out there in the space. So the orange dots on this graph represent the MedGemma models. So if you look at the MedGemma 27B model, the one I mentioned earlier, its performance is actually not that far off from others like DeepSeek and even, not shown here, but Llama and OpenBio LLM. So there's many other models that are out there that are closed, they're not open, But MedGemma, for something that's available as open source, its actually performance is quite comparable, and that's really great to see. So this is really just to give you a sense of the baseline performance on clinical knowledge and reasoning is really quite on par with the larger models that are out there. I also wanted to kind of give you, as an audience, a sense of how was MedGemma actually evaluated. This is just an example, a snapshot of how this was done. Given the fact that MedGemma, the intention is that the medical or clinical community is going to be using this for specific use cases, we wanted to make sure that it was clinically validated. And so we did extensive work with clinicians and with researchers to ensure that what we put out there is actually something that has good performance in the clinical space. So one example here is this performance of MedGemma on chest X-ray reports. So if you look at the blue, the light blue and the dark blue, that represents MedGemma's performance. And if you look at the color that is red or light red, that represents I believe, yeah, that represents human radiologists. And so we wanted to compare the performance of MedGemma reading chest X-ray reports against original radiology reports. And we found that it actually performs really well. 81% of MedGemma chest X-ray reports were found to be very similar or comparable to expert radiologists. And so this gives very heartening results to the fact that actually the performance in terms of its comparison against actual human experts is really quite good. And we continue to work on and improve upon these areas. So we expect that we would want to continue to improve on these models, and the performance will continue to improve. So let's talk about the real world use cases and what has been the adoption. We actually only released this model earlier this year in May, but we've seen widespread adoption and a lot of favorable and positive use cases and mentions in the media and in the community of developers. So here's an example, just a snapshot. Within just a few weeks of us releasing this on MedGemma, releasing MedGemma on Hugging Face, over 200 fine-tuned and quantized versions of MedGemma were then shared on Hugging Face. We also have a lot of people asking for us to release a more formalized Google's version of quantized version of MedGemma so that they can easily deploy them in lower resource settings or resource constrained settings, and we're looking into that. There's also people in the community have also looked at MedGemma's performance across various different benchmarks, and MedGemma was found to perform really well on certain benchmarks, one that was focused on visual question and answering, one that was focused on multilinguality. There's people also looking at, how do we, build and provide tutorials about MedGemma within the community. And so even before we started putting out tutorials, people were sharing tutorials and their own learnings from having used MedGemma. And the idea here is that we really wanted to make it easy to use, easy to access, and also understand what the pain points might be so that we can quickly address that need in the community. And so that process is ongoing. We're also seeing some really interesting use cases being evaluated. Some are in the domains that we would expect. As I mentioned earlier, MedGemma, one of the data sets it's been trained on is on ophthalmology data sets and fundus images. And so we've seen that some people very quickly use MedGemma and build an application over using MedGemma for diagnosing diabetic retinopathy. Some people have looked at it in domains that we actually have not formally evaluated the model on. And that one example is, for example, brain tumor. Someone fine-tuned MedGemma on a brain MRI data set and found the performance to be pretty encouraging. Someone else looked at multilinguality. We've had people develop a fine-tuned version of MedGemma using the French language, so it's like a French medical assistant. We've also seen it perform really well in Chinese, and there are people who are looking into Indic languages as well. So a lot of interesting use cases that are coming up. Some people even looked at it in terms of, can we deploy this on a phone? Can we do this, in an iPhone? So there's a lot of different people who are experimenting with it, because the whole idea here is that it's easy to use, and we want to make sure that people are able to experiment it and reduce the barriers to adoption. And so in summary, compared to some of the larger API-based models, what is MedGemma providing? It's providing the advantage of substantial adaptation for your specific, let's say, research needs if you're an academic researcher, or improved performance if you are a developer putting together a health-based application, or you are a organization that wants to use a larger MedGemma model and build a large solution on top of it. It caters to all the different kinds of users that might be interested. The other advantage of MedGemma, which I didn't mention earlier, is that it allows the data to stay on site, so you can maintain data sovereignty, which perhaps you may not be able to do with other kinds of models. And so sometimes, whether you're a government or you're a healthcare system and you have very strict organization policies around where the data needs to reside, MedGemma enables you to keep that data on-prem or on your local server. That's no problem. As I mentioned earlier, it also allows offline uses, especially in areas where you might be in remote settings or have unreliable internet connectivity. Low inference costs compared to things like other larger models. And the other thing is that it can be used for a medical device. It can be used to build software as a medical device. Obviously, the onus is on the innovator or the developer or whoever's building their solution using MedGemma. The onus is on them to seek the regulatory approvals that are required to be able to use them appropriately in their specific settings. But as per the terms of use, we say that it is set up to be able to serve as a foundation for a medical device, as long as regulatory approval is obtained. It's also able to be integrated with Google Cloud. So I've been mentioning earlier that you can use it, regardless of who you are, whether you are a different, if you're using a different kind of cloud platform, that's fine. You don't have to use Google Cloud Platform. But actually, MedGemma is really well set up to provide scale production-grade support if you are using Google Cloud and if you decide to use Google Cloud. So these are the various different benefits that MedGemma enables. And we're really excited to see some of the kinds of interests and use cases that is appearing out in the community. A few examples I can share of how people are thinking about MedGemma is they're looking at it for clinical decision support and workflow automation. So for example, how do you automate administrative tasks and make it easier for doctors, or providing doctors with a treatment plan and treatment recommendations based on patient history, providing differential diagnoses and things like that. People are also looking at MedGemma for reducing documentation burden. So how do you generate clinical summaries and notes based on transcripts or patient medical history? People are also looking at MedGemma for essentially parsing through vast amounts of EHR or EMR data and summarizing that data into actionable summaries for doctors, so that it saves them hours of chart review for patient. And people are also looking at it for how do we build patient-facing tools for patient education and patient engagement. So there's a lot of different ways people are looking at it. And even educational chatbots and things like that. So there's a lot of opportunity to be able to use MedGemma in various different capacities. I've just named a few examples. So to end this, I just wanted to kind of share the links here, some of which I shared in the previous slides as well, but putting it all together on this slide. And maybe if you want to take a picture of this might be helpful. These are the QR codes that can lead you to the various different links that I just shared as well. So these are the links to our main site, to the developer forum where you can ask questions, and we are checking and responding to them daily. So any questions, whether it's technical or understanding about use cases, feel free to reach out. We also have it available on Hugging Face. So various different sources here. I do want to just spend 1 minute before I take questions on the last piece here at the bottom right-hand corner, the QR code for demo apps. We have a lot of demos that we've put out for people to look at. Let me see if I can share that right here. I hope this is visible, this page here. This is on Hugging Face. We have released several different concept apps. What we mean is that these are not apps that you can just plug and play and use them for your specific settings, but they're meant to show you the art of possible and inspire ideas as to how you could use MedGemma for various different uses. So one most recent example that we have released is a radiology learning companion, for example. This example is looking at like education for junior doctors or medical doctors in training, and helping them learn and build knowledge on being able to read chest X-ray reports. And it is grounded on WHO chest X-ray guidelines. So if I click on it, you're able to essentially go to these apps and view the demo and walk through the demo. And then that really helps you give a sense of how these are used. The other app here, an example, is Appoint Ready, again, using MedGemma to essentially help healthcare providers gather patient information before pre-visits. So essentially building like an AI agent that is gathering information from a patient about their condition, what their problems were before the doctor actually sees them. So that when the doctor meets them, it's a very efficient summary of the patient condition, and the doctor is able to have a very focused and efficient meeting with the patient, and a lot more deeper, richer insights that he's able to gain from that pre-visit report built with the AI agent. So that's just kind of giving you an example of some of the areas that we have put out there. So I'll stop there, and I wanted to make sure we leave the last remaining 10 minutes for Q&A.
All right, Jawad Rizvi, please proceed.
Thank you. Actually, I just wanted to know that what are the recommended use case? Like do you recommend that we should use MedGemma for our patient side? If our application is in the use of patients, the public user, would they be able to upload their X-ray images or MRIs to get reports, or you only recommend the clinical side usage where a laboratory or diagnostic service input the technical form of that MRI or X-ray, which is like in MRI there are DICOM files, every slicing, right? So what is the recommended use? Because I believe when patient upload directly from their mobile cameras, there could be interference or some kind of deterioration of the image or lighting issue. So the readings could not be perfect.
Yeah.
What are your recommendations?
So we recommend people try what like essentially, because MedGemma has been trained on medical images and medical text and can reason over them, there is no reason why one cannot try using it for patient-facing applications as well as for clinical-based applications. So both sides of the coin are perfectly valid areas to look into and investigate. But the question you asked around if a patient uploads a certain image, if it's just like an image from their phone, so that's the part that we would encourage people to actually test the performance of MedGemma on those kinds of images, because MedGemma has been trained and its performance has been evaluated on specific medical images of a certain quality and grade. So chest X-rays and certain modalities, right? Chest X-rays, dermatology ones, some of them are actually mobile phone based, some of them are actually professional, proper taken images that are properly taken. So, it's been looked at all of that. But if you're going to build something that, like, you imagine that a patient is going to upload an image that's taken through their phone, well, I would absolutely strongly indicate no matter what you're looking at, you have to evaluate the performance of the model for your specific application that you're building using MedGemma. MedGemma is just the engine to the car you're building, right? So you want to test out your car, you want to see how it's working. So the onus is on you to make sure it is actually working well. But we can very comfortably say that we have, we've also published it on our website, how the performance of MedGemma is across those different data sets that it's been evaluated on.
All right, thank you. Jawad, you have a secondary question? Please make it quick. Then Daniel,
Yes,
you will follow.
I just wanted to ask that what would be the accuracy if a patient is uploading the pictures, and would the results would be accurate, because a patient would be depending on our application opinion and report and everything. So
yeah, so
would it be
so I think I need to understand if your what is the kind of image the patient is uploading. Is it their own image, or is it a
No.
doctor's image taken at the doctor's?
Maybe the reports, like, the X-ray report, X-ray film and the
Yeah.
MRI or something.
Yeah.
Would it
Yeah.
be, would the result would be accurate? Like
Yeah, so you can check on the
response of
website
your.
for the. Yes, yes, I understand. You can look at their website, the link that we have that tells you all the performance. That's what I was sharing earlier. If you click on those QR codes, we've shared what the performance would be like for the different modalities. For chest X-ray, what is the performance? For dermatology, what is the performance? We have all of that very deeply detailed on our website, and that will provide the answer to your question.
Thank you very much. Daniel, over to you, please.
Thank you. I wanted to go back to the next Gemma model for images. So in this particular use case, I understand that the model has already been trained with a number of images that Google has had access to. How do we ensure that the model continues to evolve, or do we have a way to train the model with all of the images that we may have from our center?
You would absolutely have to fine tune it, because that's essentially what will enable you to make sure that the performance is according to the way you would expect it. So let's say, you want to check against, a specific population that's, within your setting, you would have to fine tune it. So the model itself is it's dynamic in the sense that you can't, we would encourage you not to just use it out of the box. Please fine tune it. Please use your data set to build and fine tune and actually improve upon the performance.
Thank you. Adnan Jabbar, Dr. Adnan Jabbar, over to you, please.
Thank you, Dr. Hazfar, for the meeting and a great session, by the way. I just had one question, very pertinent to this radiological side, because currently I'm dealing with some of the systems which are radiology based. We specifically work with the Diacom based systems. So I think I have not heard about Gemma directly pulling the data from Diacom, because the problem is every time we get a scan or something, we get it in film form. To take a picture of the film and then reading it, putting it back to the data causes a lot of artifacts and a lot of
Yes.
issues which can be misdiagnosed and misled the patient as well. So I think that's my point of contention here. Thank you.
Yeah, that's a great question. We're bringing in DICOM capability. That's in our near-term product roadmap. So stay tuned.
All right. Zohaib, over to you, please. Quick question.
Thank you. So my question is in continuation to what Jawad asked. Let's say I'm a patient, I upload an image, and your model provides, let's say, a description or an explanation of whatever the image is about. In this case, let's assume it was an X-ray. Now, who determines the accuracy of the explanation?
Mm-hmm. That's on you. We have already done the clinical validation, and with with global experts to build the model. So it's put out there with we can stand behind the fact that it performs well against the images that it was trained on. So that is, we can, we're very clear on okay, these were the different data sets we evaluated. This is its performance. Now, if you want to look at its performance on your data set, your specific set of X-ray images, then that's where you have to evaluate its performance and then see how it's doing. You might want to perhaps use if you want to have some kind of ground truth, I suppose use radiologists that are in, provide your ground truth to be able to perform, evaluate its performance. And like I said earlier, you can use MedGemma out of the box, but really what the idea here is that you're actually going to make it specific to what you need, right? So that's why the fine tuning is an important component of using MedGemma to build your application.
Well, that I understand, but the patient is going to get an explanation right away. So that actually puts the onus on the patient. And if it puts the onus on the patient, isn't it going to be...
Onus on the patient how? Sorry, I may have missed your question a bit.
You see, as a patient, I'm seeing an explanation, which is given to me through a railroad, which I have built into my application.
Yeah.
So if I get an explanation as a patient, how do I know it's right or wrong? I mean, there could be maybe 0.001% chance of it being wrong, but it could be right. And there's no certainty.
Yeah, that's the thing with any health models, right? No one can ever say 100% that there is no mistake. So we, as from our perspective, we have done as much as we can, and we continue to work on building the model. But as with any kind of AI foundational model that is out there, there's always going to be some level of uncertainty. And so that's the, from our side, we have done as much as we can to make sure that people are comfortable to use it. But ultimately, you would have to go through your own set of experimentations to make sure that comfort level is there for you to put that application out there.
All right. Richa, we have a few minutes left, or for any further questions? Do we have a few minutes left for any further follow-up questions?
I think I saw a few hands raised. Daniel
Okay.
and
Daniel, please proceed.
Sorry, that was from before, so I never lowered it. So I'm good.
All right. Jawad Rizvi, you have a follow-up question? Please proceed.
Yeah, thank you. Richa, I just, as you said that it will be our own, it will depend on us how we convey the accuracy of the results. But it will help me if you let me know that when you people will be, were training this model, what is the percentage of those patient driven data where a patient can, upload? How much was the, that data on the training model, and how much was the clinical side input, like actual X-ray images properly scanned or something, right? So this can give us a confidence that your model is already trained on publicly provided data through their phone cameras and other. So this can give us some kind of confidence in that. So
yes. Would it be helpful if I just showed you on the website where it's all there, or would maybe if you want to email me separately, because we have detailed all of that information on our website. So here's a quick look at our website just for everyone's benefit. If you scroll to the bottom here, it talks about the various different models that we have. So let's say you want to learn a little bit more about MedGemma. You can click on this link here, and it takes you immediately to the overview, description about how this model works, what was the how was it developed, what are the different, how do you get started with using it and things like that. So for example, if I went to the specific section on get started with MedGemma, this talks about how you can actually run it. Model card is where you get the details about technical specifications, model architecture overview, inputs and outputs, and performance on the actual various different data sets that were looked into. So I'm happy to, you can look through these links, and please feel free to write to me, and I'm happy to provide further details as well and make sure that you're comfortable with the response.
All right. Richa Tiwari, we are extremely grateful to you for according us time, especially we are Digital Health Association of Pakistan. We are extremely thankful, and we hope that this technology, use of technology, will help improve the health outcomes for the poor people and the underprivileged in Pakistan. We will stay in touch. We are Digital Health Association, and we look forward for Google Health AI collaboration with Pakistan and to help people of Pakistan to improve their health outcomes.
Thank you so much. I'm really deeply grateful for the opportunity to come and present. Really appreciate all your questions. I love the passion and love all the questions and the engagement here. So thank you so much for your time and for your attention. And as I mentioned earlier, I'm very accessible through emails should you have any questions, any follow-up questions from our discussion today. So thank you so much.
Richa, as we discussed earlier, depending upon your schedule and availability, we'll have a follow-up hackathon, whatever, maybe it may be a regional hackathon for the developers, so that as to how actually we can implement this via all this integration and configuration. Okay, so the developers can have a hackathon sort of exercise for that. Okay, as per your schedule. Thank you very much. We are extremely grateful. Take care.
Have a good evening, everyone.
Thank you, everybody, for your great participation. We are extremely grateful. Thank you very much, Rich.
Thank you.
Hello everyone. Is there any admin here?